compared them to about 2,000 samples from our lab. They're using the urine culture, like we talked about. We're using PCR. What I want to share with you today briefly and how this can benefit your organization is getting results back with PCR, and that's just molecular diagnostics. So we're going in and instead of growing something, we're using technology, 21st century technology, to actually find out what's happening, and we're getting results the next day about 100% of the time, 99.9% of the time. With urine culture, you never see that. Am I accurate in saying that? Lisa says sure.
Yeah.
Okay. I want to share just real quickly also on the positivity rate with urine culture. You probably get sometimes a lot of inconclusive results back. When that happens, you just assume, well, we'll try broad spectrum antibiotics and hope it works.
Yeah.
With PCR testing, we're much more accurate, almost 40% of positivity rate. I want to show you what our results look like really quick. So this is an actual sample. What you would actually get when you send in a sample to us, you'd actually get results that look exactly like this. So the patient's name's been blinded out. Up here you see that there's a positive, okay? On this side, there's two organisms that are in red. Those identify which organisms are positive. So we automatically know that it was positive for UTI. Here were the organisms causing the infection. On the back, we identify the drug antibiotic resistance, so you know which antibiotics to stay away from.
So the ones in red you would not prescribe.
Correct.
Okay.
Yep.
And what's NKR stand for?
No known
Resistance.
resistance. Correct.
Okay.
Yep. But here's the part that, and this kind of, these get into a lot of names that sometimes are a little bit of a tongue twister for me. And so if you're anything like I am, I go straight to the comment section and it says, okay, these were positive, here's what to stay away from. And in this comment section, our medical director actually lies it all out for you and says, here's the positives, here's the levels, here's what you can now do about it, and here's a targeted therapy. So the provider gets this and say, okay, well, we see what's going on, we know what to use to treat this infection, and now we have a targeted approach to treat it the first time rather than just doing broad spectrum antibiotics.
Got it.
Does that make sense?
It makes sense. Can I take a timeout real